Hi, I'm Justin Riley. Today on Wisconsin Doctors, orthopedic surgery and joint replacement. We'll be on location at Fort Healthcare here in Fort Atkinson to learn that it's really not as scary as most people might think it is. My guests will include orthopedic surgeon Dr. Isidoro Zambrano. He's the orthopedic surgeon here at Fort Healthcare. We'll also be joined by Joanne Vels, the joint care coordinator, Dawn Kubley, physical therapist, and we'll hear from a patient, Linda Schemke-Yawn, who had her hip replaced here at Fort Healthcare. It's all coming up right here on Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Orthopedic Associates Center for Joint Replacement. And my first guest is Dr. Isidoro Zambrano. Welcome. Thanks for having us here.
Thank you.
Talk to us a little bit about who you serve here at the Center for Joint Replacement and what you specifically specialize in.
Here at Fort Healthcare Center for Joint Replacement, we specialize in shoulder, hip, and knee replacements. We're one of the actually the only hospital in the surrounding area with a specialized table that allows us to perform hip replacement via the anterior approach. There's approximately 70 years of orthopedic experience with my colleagues and I, and we serve the surrounding community here, and that's what we do.
Awesome, awesome. It's very good that you have such a specialized I guess, service located right here in Fort Atkinson. That's very cool.
Correct.
Yeah.
We try to give our patients the most up-to-date and state-of-the-art procedures as well as techniques that we go and learn and provide good care for our patients.
Always learning.
Dr. Zambrano, how do you determine if someone needs a joint replacement surgery?
Most of the time, it's going to be a patient who has degenerative disease. So, normal wear and tear. Normally you try to treat them with non-steroidal anti-inflammatories such as ibuprofen or naproxen, send them to therapy. We ask them to modify their activities, which also helps. But once that fails, then we indicate them for a joint replacement.
Like in my case.
So the joint replacement is really kind of like almost the last resort. You want to try to treat that pain and whatnot in as many different ways as possible before resorting to that.
Correct. Joint replacement surgery has gone through many hoops over the last several decades, and it's one of the most successful surgeries that orthopedic surgeons can give to their patients.
Yeah.
It provides pain relief, it restores their function, basically gives people their life back.
Yes, absolutely.
Dr. Zambrano, you mentioned the anterior approach hip. Can you tell us what that all entails?
Sure. Well, there are several ways to skin a cat, several ways to approach a hip.
Yeah.
Most surgeons will come in through a posterior approach, which is great. It's a good procedure. You can do it rather quickly. The advantages of coming in through an anterior approach is that you don't take down any of the muscles, so it's muscle sparing. You go through the muscle planes as opposed to taking muscle down. You can also use intraoperative fluoroscopy, which is an X-ray in the operating room to verify your position and put the implants in perfect position every single time. You restore their leg lengths, and there's essentially very minimal risk for a dislocation or any nerve injury that can happen with the posterior approach.
Intraoperative fluoroscopy.
Yes.
That is a mouthful. I'm glad I wasn't the one that had to say that.
So we use X-ray in the operating room to verify
Got it.
our component placement.
Since so many hospitals provide this kind of provide hip and knee and shoulder replacements, why do you really think people come to Fort Atkinson, Dr. Zambrano?
I think they come here because of the expert care that we provide, as well as a personalized touch. It's a very small community here in the area, and I think they just want to be treated as a person as opposed to a number.
That's fantastic.
We see them out in the community,
Yes.
and
You guys are part of the community.
correct.
That's excellent.
They come back and visit us.
Oh, they do? That's
Yeah, they
great.
do. Linda has come back a couple of
Yes.
times to visit us and just show off her progress.
Yes. Well, awesome. Awesome. Well, we'll talk with Linda a little bit later in the show. Dr. Zambrano, thank you so much for the information. It was great talking with you. But don't go away. When we come back, we'll be talking with our joint care coordinator, Joanne Vels, right here on Wisconsin Doctors. Stick around. Hey folks, welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Orthopedic Associates Center for Joint Replacement, and I'm joined now by the Joint Care Coordinator, Joanne Vels. Welcome.
Thank you.
Good to have you with us today. So I was really impressed to find out that the Center for Joint Replacement is actually ranked one of the highest in the state. What is that based on?
Well, one of the things we're really proud of here at Fort Healthcare is we have over a 90% return to home rate for patients, which means they do so well that they don't require going to any nursing home for extended
Sure.
rehabilitation. They're able to return home. They're able to return home after only spending 2 days here at the hospital with us, which is also wonderful. And we have an overall patient satisfaction rate of 85% compared to the state average of only 65%.
That's very good. And 2 days and then they get to go home. That's really good.
Correct.
Impressive. Yeah.
Joanne, could you tell our audience a little bit about what the joint replacement program is all about?
Sure. The joint replacement program is a comprehensive program that blends the needs of our joint replacement patients with the expertise of our providers. Our specially trained staff work with the patients, and they get them up and moving the day of surgery, just a few hours after surgery. Keeping patients in a healthy mindset is a major component of this program. So patients come into the hospital for an elective surgery, they're healthy. We don't want to leave them laying in bed for no reason.
Right.
So we do get them up and moving shortly after surgery. And we not only work with the patient, we also encourage them to have a coach with them, so a family or friend. And we work with that coach as well, so they know what to do with the patient when they return home. They feel comfortable working with their loved one when they return home. It's a team approach. It's focused on getting patients to the providers, actually, providers having
Sure.
consistency in care. So the patients have consistent care from nurses.
Sure, yeah.
Their providers come in and see them.
And having that coach is just a really, really nice thing. And I got to tell you, I'm really impressed by the fact that you're getting patients out of their bed hours, not days, hours after their surgery to move around.
Correct.
That's really important.
Sometimes it scares them, but
Sure.
after they do it, they are so amazed that they can do it. It's kind of a wow moment for them.
Yeah, I'm wowed and I've never even experienced that. So, yeah.
Now, Joanne, can you just share with the audience what the preoperative joint class involves?
Sure. It's a very extensive program. It's focused on preparing patients for surgery. We want to teach them what they need to do before, during, and after surgery. So they come to a preoperative class. They start a home exercise program after the class to strengthen and stretch the muscles that we're going to be working on. It makes therapy easier for them after surgery. They also meet with a dietitian to teach them about healthy foods for healing. They meet with a pharmacist so they can ask questions, and the pharmacist does an in-depth review of their medications. We also have discharge planners that help them with any discharge needs they may have, equipment needs, and that type of thing. We give them tips and tricks about things that they can do before surgery to be able to move around their home a little bit easier after surgery.
Sounds like there's a lot of support that's put in place before the surgery happens.
But there's a lot of information before surgery.
Yeah, that's great.
And then also, Joanne, before the surgery, there's always a concern about the pain.
Correct.
And could you just highlight maybe a little how that pain is controlled and what kinds of things people can do
Sure.
in order for that
Sure.
diminish that pain?
The first thing that's important for patients to know is they are having major surgery, and it does take some amount of pain to get through this. The doctors use an injection during surgery on some of the patients to help with pain control after. They have oral and IV narcotics when they come back from surgery, and ice. And we also can do guided imagery and aromatherapy with essential oils are some of the things that we focus on.
Wow, very cool. Essential oils and aromatherapy, all part of the plan.
All rolled
That's
into
awesome.
one.
That's awesome. Joanne Vels, Joint Care Coordinator here at Fort Healthcare, thank you so much for joining us.
Thank you.
Don't go away, there's more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Orthopedic Associates Center for Joint Replacement. And next we're going to be talking with Dawn Kubley, who is a physical therapist here. Dawn, welcome to the program.
Thank you.
Good to
Glad
have
to
you
be
with,
here.
Yeah, good to have you with us today. So we were talking with Joanne a few minutes ago about how you guys actually get the patients up and moving out, not days, but hours after their surgery. Can you talk us a little bit about what some of the benefits are of doing that?
I'd be happy to. We take a wellness approach with our program. It's an elective procedure. People are medically approved to participate in the program. And the program is very robust. It's an intensive program. The body wants to move.
Right.
So we encourage patients to do early and frequently walking and exercising. And it kind of sets the tone for the remainder of their hospital stay, as well as once they get home to continue with the intensive program. So the day of surgery, usually 2 to 3 hours after they've returned from the recovery of surgery, they're dressed in their own clothing, whether they're in their own shorts or lounge pants, pajamas, and we're walking down the hall and starting some exercising. Couple things. People feel better. They don't have the stiffness and such
sure.
just by kind of laying in bed.
Yeah.
The other thing is they're thrilled. People just can't believe they say, I haven't been able to walk this pain-free for perhaps years.
Yeah.
And what I think is most exciting is the patients then have a sense for, I really do have an opportunity to get back to some of the sporting events I enjoyed
Right.
and some of the activities they enjoyed, whether that's golfing or water skiing, bicycling, different interests that they might have, and that's really exciting. They have that feeling the day of surgery once they're out walking.
The day of
with us.
surgery. And people often think that it's so painful to have a surgery, I don't want to do it, but then they realize that even hours after the surgery, they have less pain than they did before the surgery, which is
It's
incredible.
true.
And I like how you said that the body really is meant to move. That's what we're kind of designed for as humans, so that's the kind of the reasoning for kind of getting people up and moving right away. So that's very cool. Very
And
cool.
while in the hospital, there is a group therapy. And so I wanted to ask you, what are the benefits of that group therapy when everybody comes together and does the exercising?
Good
and-
question.
Yeah.
Sure, it's kind of a newer concept. It's a very positive approach that we have found. So imagine you're in a room with 5 or 6 other people that have had either a knee or a hip replaced like you have, and we have dedicated therapists, and they make it fun, really fun. They're able to provide a more intensive exercise regime than we used to offer. And then just having the other people in the group setting, it's very supportive, it's very motivational. A 50-year-old will see someone 82 across the room doing perhaps better or with greater ease than they are, and that's just a little friendly competition.
Sure.
is healthy, and we find that. And then, as Joanne mentioned, with the coaches, is another part of the group therapy. So it's just a real exciting and very motivational setting for
And as
exercising.
I recall, we did a lot of laughing. It really
Sure.
was a
It really
fun.
was fun.
It really was.
And adults
Yeah.
need to have fun too.
Yeah,
I think that's
yeah.
really important to
And in
remember.
spite of having surgery and thinking that there's pain and
Right.
the work involved and everything, we just enjoyed each other and had fun exercising.
That's great.
Yeah.
Don, 2 questions. How long have you been a physical therapist?
About 20 years.
20 years. And since the induction of the Center for Joint Replacement here at Fort Health Care, what changes have you seen in patient outcomes?
Well, the program has existed for 5 years, and I think probably the most heartwarming outcome is the quality of life that people have now gotten back to experience. Specifically, patients report a reduction in pain from prior to the initiation of this program. People are walking further, probably has tripled since the program started. Average distance people are walking is about 625 feet, something like that. That's the length of 2 football fields.
Wow.
And so, and that's in one trip. So
Wow.
they're walking that many times before they leave. I think Joanne had mentioned also 9 out of 10 patients go directly home, and that's a real benefit. Length of stay used to be, before the program was initiated, maybe 3 or 4 days. It's now
Right.
2. So patients that have surgeries on Monday, they're going home on Wednesday afternoon after
Wow.
the joint group exercise session.
Yeah.
And then if someone has had a knee replacement, we've experienced the patients have demonstrated increased range of motion.
Right.
The average knee flexion is 110 degrees. What that translates to is people are able to do stairs. So
Yeah.
people are able to go home and get in and out of their house, go up to the 2nd floor if that's where their bedroom is, and do stairs. And then probably, again, kind of coming back to the quality of life, is we hear from patients, I'm sure you do too, Dr. Zambrana, when people come back for follow-up care with you, and patients are coming back to visit with us as well. Not only are they back to the canoeing and golfing and hiking with their grandkids and with our recent snow, getting back to some downhill snow skiing coming up. They were able to get back to those activities that they enjoy, and sooner than they thought.
Sooner than they
So
thought.
very exciting.
That's very exciting. Well, Dawn Kubley, physical therapist here at the Center for Joint Replacement, thank you so much for joining us today.
Thanks.
Don't go away. There's more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Orthopedic Associates Center for Joint Replacement. And we've heard from some providers so far, but now we're going to hear from a patient. I'm joined now by Linda Shemke-Yawn, who is a hip replacement patient. Linda, welcome.
Thank you.
Good to have you with us today.
Thank you.
What made you choose Fort Healthcare to get your hip replacement surgery?
Well, there were a number of things that I had to consider. One was, of course, you want to get the best care possible.
Right.
And in doing some of my research, I asked around and found that the couple of the people that I knew, they had relatives that had surgery at the Fort Healthcare, and were very impressed with how the kind of quality that they got.
Sure.
And I wanted a place that would be close to home.
Sure.
My insurance, of course, had to be covered
Right.
with that. And by the time I got done with all the things that were important to me, one specifically being the anterior method, I was excited
Yes.
that I found a place that I felt very comfortable. Once I started that process, it got better and
Right.
better. Mm-hmm.
That's excellent.
Yeah.
Linda, I spoke a little bit earlier about the extensive preoperative education. What benefits do you feel you got from that?
Oh my. Where do I start? When we got there, it was a room full of other people that were also going to have joint replacement. And we were given a binder that had all kinds of information in it that we could go over at our leisure, to kind of ease us into the procedure and what would take place. And we were able to ask questions. We had other people there that could ask questions that maybe we hadn't thought of.
Right.
There is also a slideshow that we were able to see. We were able to hold that, what do you call it, the replacement in our hands and actually feel what was going to go into our bodies. But all of that just made us feel so much more comfortable. We were able to share. We didn't feel like we were alone. And by the time I was driving home, and I thought, oh my gosh, the stress kind of just left me, because I felt so much more confident that I was going to be taken care of, that they had it all laid out for me, appointments made, and it just kind of took that stress away.
And I'm glad you say that, because that's one of the thoughts behind the program, is to make this a less stressful event for the patient and their family.
Yeah.
Good. Accomplished.
Definitely.
That's great.
Yep.
Linda, one of the things that you talked about being important to you was the quality of care. Maybe you could share just a little bit about how that was a home run for you, the quality of care.
You're probably going to have to stop me from raving about the care that I got, because from the time that I met with the doctor to the joint camp that kind of put it all in place, to having the surgery and being able to see the people that were going to take care of me in the operating room, to the care that I got after, to nurses that were so compassionate and so concerned about how I was doing, to wanting to really do something about that pain so that I would become comfortable. Every aspect of it, from the nurses coming in, when one nurse would leave, another nurse would come in and say, this kind person is going to take care of you now.
Right.
Throughout the whole entire process, the food was absolutely over the top. It was wonderful.
Okay,
I mean,
well,
that
you
was
sold me
like
then.
that was like the icing on the cake.
Absolutely.
But the whole process was, I just could not say enough good about these people. They just so impressed me. It was far beyond what my expectation would have been. And I would have said, oh, I had the first surgery, and then I thought, well, maybe they had 3 good days or something of good care. But then I had the second surgery, and the second surgery matched the first surgery. It just was over the top with just the most qualified people with the most compassionate and excellent care.
I wish we had a whole nother segment for you to talk a little bit more about that, but we're out of time, unfortunately.
Okay.
So.
That's okay.
Linda Schemke, a hip replacement surgery patient here at Fort Healthcare. Thank you so much for joining us today.
Thank you so much.
And that's all the time we have for Wisconsin Doctors. From all of us here at Fort Healthcare and CW57, we're reminding you to live longer and live better. We'll see you next time.